2020. WHO Europe sets out an ambitious vision under the leadership of newly elected Regional Director Dr. Hans Kluge. The European Programme of Work aims to build stronger, more resilient health systems for all. A vision centred around one unshakable principle: leaving no one behind. Just weeks later, a pandemic starts to sweep across the globe. COVID-19 pushed our health systems to their limits. Yet, the pandemic also elevated the importance of public health. Everyone was talking about health. Governments, policymakers, people. We showed solidarity with health workers. Communities came together. Safe, effective vaccines were developed and rolled out in record time. 1.7 billion vaccines were administered in the European region alone, saving well over 2 million lives. But our work didn't stop with COVID-19. WHO Europe fulfilled every single goal of the European Programme of Work, the EPW, including a special focus on key flagships. The Pan-European Mental Health Coalition, supporting reforms in 42 member states. Empowerment through digital health, developing strategies in 44 countries. The European Immunisation Agenda 2030, from boosting childhood immunisation to maintaining a polio-free region. And behavioural and cultural insights to help health programmes factor in and surmount barriers to better health. Complementing and supporting the EPW, the overarching flagship of flagships, primary healthcare, taking health to where the people are. In expanding universal health coverage, an emphasis on financial protection, working to make a range of medicines more affordable and safeguarding people from the costs of catastrophic illness. Enabling WHO Europe to do what it does are its people. The Executive Council, working as one team with the Regional Director towards strengthening internal coherence across the regional office. The Senior Leadership Team, and all staff across the entire region, without whom WHO Europe's achievements simply wouldn't be possible. These achievements are underpinned by health as a fundamental right. That firm belief drives us to reach the most vulnerable: migrants and refugees, LGBTQI+ individuals and communities, indigenous populations. By promoting economies of well-being, we connect health with prosperity. When people thrive, economies thrive. Health also connects us across geographies and borders. For example, through our roadmaps for health and well-being in the Western Balkans and Central Asia, or through our Small Countries initiative. Health is central to response and recovery amid disasters and conflicts. In a once more predictable region, but now in permacrisis, we've been there for member states in need. For Ukraine, whose health system remains standing despite the relentless pressure of war, and for Ukraine's neighbours, caring for millions of refugees. For Turkey, where emergency medical teams have responded heroically to devastating earthquakes. For Israel, supporting mental health services for traumatised providers and communities after the 7th of October attacks. For children in shattered Gaza, helping coordinate their medical evacuation to Europe. And, not least, strengthening regional health emergency preparedness and response through the Pan-European Network for Disease Control, an evolving network of networks to facilitate collaboration and knowledge sharing across Europe and Central Asia. Ultimately, our member states need resilient health systems to ensure a sustainable future. For Europe, it's time to act by prioritising investment in healthcare worker training and retention, improving pay and working conditions, by using digital technology to support the healthcare workforce and patients alike, by laying the groundwork for ethical digital health systems, including AI, that reach and benefit everyone, not the privileged few. But shaping the future of health goes beyond health systems and technology. Shaping the future of health needs young people to be involved in decisions that impact their health and well-being. We're achieving this through Youth for Health, a regional network that's become a driving force, mobilising young leaders on issues from alcohol abuse to reproductive health, from mental health to gender equality. Our partnership with youth complements our partnerships across the spectrum. Through some 270 collaborating centres, through partnerships with the private sector, and through partnerships with other WHO regional offices, and with member states of other regions. But as the COVID-19 pandemic recedes further, so too does the world's attention to health as a priority. Political will and investment are waning. Political divisions are rising. Politics is driving dangerous disinformation about health. It's precisely now that our collective focus on health must be sharper than ever. A focus that includes building health leadership, such as through the Pan-European Leadership Academy, strengthening public health leadership while tackling the underrepresentation of several member states in international governmental organisations. 4 years ago, we set out to transform public health across Europe and Central Asia. In the face of unimaginable challenges, we did just that. But our journey is far from over. There are other priorities to tackle: the climate crisis and its health impacts, antimicrobial resistance, the enormous burden of non-communicable diseases. But we can tackle these together. The future is ours to shape. Together. United action for better health. Our promise. Now and always.